Hi, I am Dr. Esther Park, child, adolescent, and adult psychiatrist. I have been practicing at least since 1995, and mostly I practice in an outpatient setting. The name of the practice I work in is a group outpatient mental health practice called Oak Health Center, and we have 3 locations in Southern California. I also am a co-founder for Oak Health Foundation, which is a nonprofit organization raising awareness for mental health and trying to reduce stigma and the prevalence of suicide. What's really important about these 2 organizations, we are trying to bring comprehensive care, especially to integrate the spiritual aspect of the Christian faith within mental health. I welcome you to the MMC course of Mental Health Issues in Children and Teens. One of the main goals of this course is to increase awareness regarding the importance of mental health issues in children and how it affects the children, teens, and their families. And also how you can intervene and be an instrument for God to use in helping these children when they're going through these struggles. The first topic of this course will be anxiety in children and teens.
What could cause children to have anxiety?
All children, all people have experiences of some level of anxiety, nervousness, fears, and they can be normal, or what we can say is normal levels, because everybody will experience them. But if you are asking about the cause of anxiety disorders to the level of dysfunction, the causes are multifactorial. What I mean by that is there are biological issues, psychological issues, sociological reasons, and of course the spiritual. And there is a diagram that I usually use to describe that to my clients, and I'll draw them for you right now. For example, the biological factors include genetic reasons, medical problems such as thyroid problems, anemia, or a neurological issue of the neurotransmitters such as serotonin issues, and psychological reasons, for example, the perspective of always being in danger, and sometimes that is caused by a traumatic event, and there are intrusive memories or erroneous thoughts, incorrect thoughts that keep haunting them. And there is also sociological reasons. That means like the environment, right? There are many neighborhoods, for example, that danger is all around and they're always frightened. And of course, we cannot forget the spiritual background of the identity of either you're a child of God or you're not. And in my opinion, if you are not a child of God, that you will never have a sense of security, even if you're receiving so much reassurance from parents. So this is a diagram many times that I show to my clients to explain the overall, it's not just due to one cause.
What are normal levels of anxiety versus abnormal levels that may require treatment?
That is a very great question. I would say that normal levels of anxiety are usually short-lived, and of course, according to the developmental stage. For example, fear of the dark or storms, animals, strangers. And of course, at older ages, you should not be afraid of the dark anymore. And normal levels also should be there if safety is at risk. Therefore, if you're climbing very close or walking very close to the edge of a cliff, there should be some level of fear or anxiety that harm might come to you. But abnormal levels of anxiety are ones that are persistent or excessive for the cause bringing that anxiety, and there's no relief with assurance, like from the caregiver. And when there is dysfunction, meaning when it causes a functioning issue socially or academically or in the public or in private. For example, school refusal because of an anxiety of meeting new people. And it persists and persists. That's when we know that there is an anxiety issue.
What are specific symptoms of anxiety in children that we should look for?
So generally, for example, there's an excessive amount of worry, like constantly worried and expression of that worry, even sometimes before an event occurs. An event that's coming up and they're always talking about it, they're so worried about it. Or a constant concern compared to what other children would express. I'll give you an example. Some children, or most children, aren't really concerned if they're going to be late. Usually they're the cause of being late, but they're worried that their parents aren't going to bring them to school on time. Right? So there's a level of concern that is beyond expected. Intrusive thoughts that make them worry a lot. This can lead to low self-confidence, and many times children won't say that they're anxious, but they're always saying, I have a stomach ache or I have a headache. We call that somatic or physical symptoms that could indicate that something's going on in their level of worry. Specific childhood anxieties, for example, separation anxiety, can be seen as fears of the safety of their caregivers, because if something happens to their caregiver, they're going to be separated and then they'll be by themselves. Or it can be displayed as school refusal. They don't want to be separated from their caregiver. Or they'll never go to a birthday party away from their parents. And then they become clingy and then panicky if they're separated. Those are some symptoms of separation anxiety. Another good example that's common is social anxiety. Fear of meeting new people, fear of being judged, and so they would avoid social situations. One symptom that's not that common, but we do see it, that could be a sign of extreme social anxiety, is mutism, which means refusing to talk, but they do have the physical ability to talk.
Are there any early prevention strategies for children with anxious tendencies?
I think one of the first things to really remember as a caregiver, a teacher, or an adult who loves the child is to not minimize or to not dismiss what they are concerned about, even if it seems very trivial or little. Adequate reassurance is always important, but we should not feed into their anxiety by promoting avoidance. Sometimes parents are so anxious that their kid is anxious, and then they would pull them out and never let them go back into that classroom, for example. We should always validate and even normalize of what they're going through, because many times we would reply, oh, don't worry, stop worrying, it's okay, it's going to be okay. Right? And that's not very validating or accepting the fact that they're feeling that way. We don't have to dwell on it for hours with them, but to come to their level and say, wow, it looks like you're really worried or concerned. Can you tell me what is bothering you? And at the same time, we can also share, after hearing them out, to share that actually there's no need to worry about that. Mommy will take you to school on time. Don't worry about that. So some sort of a reassuring response. And lastly, if it's very persistent, nothing that you're doing is reassuring them, it's really crippling them, then a professional evaluation might be needed. And so that's something to think about too.
Question 5. Is this a learned behavior or unique to every individual?
This is a very good question. I think for both, I'll answer the first part. Is this a learned behavior? There are times where kids grow up observing their anxious parents and the behaviors of their anxious parents. Not that they're mimicking directly about what their parents are showing, but if they see their parents anxious about something, they kind of subconsciously wonder, oh, I should be worried about that too. And then they adopt the idea of what they should be worried about. And therefore, it could carry on into their adulthood. But the second part, it is unique to every individual. The way everyone shows their anxiety is very different. In children, sometimes it's so varied, it's hard to detect that there's an anxiety. For example, one child might show it as a true expression of nervousness. I'm so scared. What do I do? But other children with the same anxiety, they may show irritability, very cranky, angry, throwing tantrums, but somebody may not know that that's actually an anxiety symptom.
What types of treatment are effective for long-term healing?
Again, here, let me use the diagram once more about the approach. We said that the causes are multifactorial. So even the approach to treatment and healing has to be multifactorial, not just one or the other. For example, biologically, if they have sleep issues, then we need to treat that, or we need to help that. For example, if they're sleeping late, but they have to wake up early and they're not getting enough hours, this will definitely affect their mood and levels of anxiety if they already have an anxiety issue. Nutrition is very important as well, and exercise and avoiding drugs and alcohol, because many teens sometimes gravitate to drinking alcohol or using marijuana or other drugs to cope. And unfortunately, it might help for a minute or two, but it can worsen the anxiety in the long run because biologically there are neurotransmitters at play. And lastly, if medication is indicated because it is such a serious issue with the serotonin levels or norepinephrine levels, then we need to consider that. Psychologically, of course, not everything is biological, right? Sometimes it is perspective, sometimes it is reading things incorrectly, misinterpreting things, exaggerating or minimizing. So this needs to be addressed. And usually individual therapy or play therapy or parenting is part of this psychological treatment. Sometimes a parent is the reason why the child is anxious. And so we would have to teach parents of sort of what to do and what not to do, right? And if they're humble enough and they follow these recommendations, then the child improves. Sociologically, we have to, for example, remove the toxic cause of their anxiety. A really big example would be, what if they're being bullied at school, right? What if they're being mistreated by a teacher or being teased by neighbors? Or maybe there's a close adult molesting them, right? There are so many reasons in the environment that can bring anxiety. So we do have to address those things. Otherwise, it'll just continue on and on. And sometimes we should involve the school officials or school staff or even the teacher to help with what's going on in the environment. And of course, it's not just these three areas, but spiritually, we need to help the child, first of all, to meet their maker meet God and to understand that there is a Heavenly Father who loves them so much and did not mean for them to struggle and suffer with such levels of nervousness and fear. And rooting that gospel and helping them to develop that or understand and develop that relationship that they can have with God personally, to the point where even if mom and dad are dead asleep and they don't want to wake them up, but there is a God who never sleeps and always there to listen to our prayers. So that's spiritually what we should do. But also as a caregiver or as a teacher, we also need to be filled by the Holy Spirit so that the true peace in us as a caregiver, parent, teacher, mentor, they can experience or feel that we have that peace and wonder, how come you can be so calm and I'm this way, right? And then there is that transfer of knowledge of where that peace can come from.